Thank you for joining us for Ask a Therapist, a Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Sean Jackson. Today we're joined by Dr. April Richardson, a psychiatrist and seasoned expert in clinical services and behavioral health, to talk about Attention Deficit Hyperactivity Disorder, otherwise known as ADHD. Let's jump into it. Okay, Dr. Richardson, I would like to start off by asking, how common is ADHD?
Yeah, ADHD is the most common childhood disorder that that people have in mental health. But it's also really common in adults too. There's about 10 million adults that have ADHD. It's about 11% of children have ADHD, so it's very common.
Would you say ADHD is more prominent in children? And does it continue into adulthood?
Yeah, most people, really the DSM, that's our kind of diagnostic Bible that we use in behavioral health, says that you have to have the symptoms start before age 7 to be diagnosed with ADHD. But a lot of kids actually age out of it. So there's about 50% that will still have it in adolescence. And then they say about 50 to 70% of people that had it as a child will have some symptoms of ADHD as an adult.
What are some signs and symptoms of ADHD that people should watch for?
Yeah, it shows up differently for different individuals. So there's really 3 types of ADHD. There's inattentive type, which is people just have more difficulty paying attention, staying focused, following directions, listening to the teacher, that kind of thing. Then there's a hyperactivity or impulsive type where you would have more fidgetiness. We used to say it's like the child's run like by a motor. So, always up and down, in and out of their seat. Sometimes blurting out answers and can be really talkative. Those are all kind of signs of that. Not thinking through before they do something. So acting without thinking. And then there's a combined type where you may have symptoms of both inattention and the hyperactivity combined.
So as someone ages or experiences more things in life, is it possible for them to develop ADHD?
Probably not, but you may not have known about it. There are a lot of compensatory behaviors or like learned skills that people will have so that it kind of hides the symptoms of ADHD. And also ADHD can be what we call as comorbid or go along with a lot of other behavioral health disorders like depression or anxiety. So sometimes that can kind of mask the diagnosis of the ADHD. So some people won't realize that they have it until they're older. But when you track back and ask them for their history, you find that, they really did have those symptoms back in childhood as well. And especially with girls, there's some kind of social norms that can mask the symptoms, or it's just not as recognized in girls sometimes. Boys tend to have more of the hyperactivity that's noticeable to adults, like in and out of your seat, up and down, jumping, that kind of more active impulsiveness, whereas girls can have things like just more social, much more talkative, getting in trouble in class for not listening because they're really busy talking to others. And so that is not always recognized by teachers and adults as being ADHD. They're kind of just labeled as, that person's just a social butterfly, or they're just really social in class. And so sometimes they get neglected in diagnosis until later.
Do you mind elaborating a little more on the differences between how ADHD presents different in kids compared to adults?
It definitely can present differently, like with the sex differences between, males and females. Also, as you age, it may be different. So hyperactivity as a child really presents, like what we said, in and out, up and down, that kind of stuff. For adults, it may just be really significant fidgetiness or just a feeling of restlessness that a person experiences. And you may be able to, get around some of the inattention if you're have some natural gifts for reading or studying on your own. It may not be that impactful in your day-to-day life through school. And so, the inattention may have been just overlooked until you get into a subject that's really difficult, or maybe transition to college where the rigor and the difficulty of school is so much more that it's hard to balance and kind of learn those tricks to get around your ADHD symptoms.
So as a parent, normally whenever the school season starts, I can see the anxiety growing in my kids as we get closer and closer to that first day. And it really looks different for each kid. As you may know, we've had other therapists on the podcast to talk about anxiety previously. What are some ways to tell the difference between ADHD and anxiety?
Yeah, so they're both very common disorders. Both can happen in childhood and adulthood. ADHD, like we said, are more of that neurocognitive disorders. So where you're having trouble with attention, focus. That can happen with anxiety as well. If you're struggling with worry so much, it looks like you can't focus and it's hard to pay attention. But it's really whether it's worry that's taking up your thoughts, that's causing the inattention, that's more likely to be anxiety, whereas it's just the inability to focus or concentrate and give that sustained attention to things. But there's not other things kind of running through your mind, or there's not that worry cycle that's going on. That's much more likely to be diagnosed, with the ADHD versus anxiety. So there are some overlaps and symptoms there, but you really have to dig into what's going on inside, that's causing the distraction or the inattention.
So on that same note, what are some ways to treat ADHD?
Yeah, a lot of people think medicines, of course, because I think medication is fairly common. You see a lot of people that get put on medication for ADHD, but for children, actually the first line is behavioral therapy and also education for the child and the parents. So there's a lot of skills, like I was talking about, that you can learn that kind of help someone cope with it so that it's not interfering with the functioning of home life and school life and social life. So there's a lot of behavioral changes that kids can make before they get put on medicine, or they may not need medication at all. But if symptoms are, really severe and those behavioral modifications and different therapies don't work, then there are really good medications that can be used that can help with ADHD symptoms. Stimulants are very commonly used medications, but there's also other non-stimulant choices to use either for kids or families that don't want to use stimulants for different reasons, or the kids have had side effects to that family of medicines, or maybe they have like a co-occurring anxiety disorder or something that would make it more difficult for someone to take a stimulant.
At what point should someone seek out treatment for ADHD?
Yeah, so, if it's affecting functioning and it's across multiple environments. So, sometimes kids can act out in one situation, but really be able to function well and pay attention and do well in other settings. So you have to really see, are these symptoms that are across multiple settings and really limiting their ability to do well or function or have a productive life? Like, are they really struggling with making social contacts, keeping friends? Are they struggling at home with listening and following directions and, thinking through things before they act? And at school, are they able to, pay attention and learn the things they need to? Are they getting so forgetful and the organization is not there that they're missing school assignments, not able to do well on tests and all of that? If it's, those kind of consistent behaviors that you're seeing across multiple settings, then I'd say definitely check in with your either primary care doctor or pediatrician, or you can call and, speak to a therapist or a counselor about it as well.
How would someone know that they have ADHD as an adult if they were never diagnosed?
Yeah, so if you haven't been diagnosed as a child and you're noticing symptoms now, or you've read about what ADHD is or read something about what it could look like in adulthood, I'd say there are definitely tests that can be performed, like psychological tests to check to see if it really is ADHD, which is a really good way to rule out that it's ADHD versus something else. I'd say, getting in with a counselor or a psychiatrist that can do a full assessment. Like we were talking about earlier, there's symptoms of other mental health conditions that can overlap, can cause symptoms that mimic ADHD. So you really want to be sure that you have that versus not. Maybe it's something else before you would get started on medication. But, there's a lot of good tips and tricks out there for just, behavioral changes and different things you can do in your everyday life if you feel like you have some symptoms that are getting in the way of your functioning that seem like ADHD, right? So if you're getting more distracted or you're having trouble focusing for long periods of time, or you get bored easily and start to daydream, there's definitely a lot of tips and tricks and tools out there that can help for individuals that are struggling with that, and just things you can start incorporating in your day-to-day.
Dr. Richardson, you've given us so much great information about ADHD today. Is there anything else that you want our listeners to know?
Yeah, there's a lot of really good online resources for parents and adults. There's an organization called CHAD, and they have a lot of information about, what is ADHD, what causes it, what is the prevalence out there, like how common is it? And it gives different links for parents about different behavioral changes to make at home that may help with children. When, what are those risk factors to lead someone to want to go get this checked out? And for adults, it gives a lot of good information about tips and tricks you can implement in your daily schedule that helps with a lot of the symptoms of ADHD. And it goes through symptom checklists, different treatment options if medications are explored. So it's a really helpful website.
Dr. Richardson, we can't thank you enough for coming on Ask a Therapist today. ADHD is such an important and often misunderstood topic. We really look forward to having you on again soon to talk about other mental health related topics. Thank you to the listeners for tuning in today. This has been Ask a Therapist, a Blue Cross Blue Shield of South Carolina podcast where we dive into mental health topics. Be sure to check out other episodes of Ask a Therapist for more mental health advice, and we look forward to seeing you on the next one.